Everyone, my name is Kalaivani Ranganathan. Today my presentation about therapeutic communication and counseling skill in nursing. Introduction. The role of therapeutic communication in nursing. Essential in nursing practice. Form the foundation of effective care. Build trust and emotional support. Foster a safe environment for patient. Boost patient outcome and satisfaction. Better communication leads to better health result. Vital for chronic illness management, especially important for conditions like diabetic or cancer. Real life strategic for improvement. Emphasize practical tools and case study. In nursing, therapeutic communication is not just about talking to patients, it's about connecting with them in a meaningful and supportive way. First, it starts with purposeful communication. Every interaction should have intent, whether that providing reassurance, gathering important or information, or simply being present with the patient. The goal is to build rapport and the sense of trust. Second, this type of communication involves active listening and empathy. It is not just about hearing words, but truly understanding the emotion and concern behind them. Empathy helps patients feel seen, heard, and valued. The third one, using open-ended question in essentially. This type of question encourages patients to share more about their experience and feeling, opening the door to deeper and more honest dialogue. The fourth one being must overlook non-verbal cues, things like eye contact, facial expression, posture, and tone of voice. These all send powerful message and can either reinforce or contradict what we say with the words. Finally, the ultimate aim is to understand and address patient need effectively. When communication is clear, compassionate, and purposeful, it is lead to better care and stronger nurse-patient in relationship. They often serve as guides, helping patients navigate not just their treatment plan, but the emotional and psychological changes that came with illness. First, we use specific technique to guide patients through difficult situations. Whether they are facing a new diagnosis or struggling with long-term management, our role is to support them every step of the way. Second, counseling in nursing include both education and emotional support. It is not just about explaining a condition or medication, it's about being the emotional helping them process what they are going through. This support is especially important for patients with chronic illness like diabetes, heart disease, or cancer. This condition can take huge toll on a person's mental and emotional well-being, and our support can make a big difference. Counseling also empowers patients to make informed decisions about their care. When patients understand their options and feel support, they are more likely to engage in their treatment and advocate for themselves. Our focus is one goal setting a building resilience. We help patients set realistic, achievable goals and encourage to them to recognize their own strength even in the face of illness. Importance in nursing. Therapeutic communication and counseling aren't just skills, they are essential tools that directly impact the quality care we provide. The approach builds trust and strengthens the nurse-patient relationship. When patients feel safe and understood, they are more likely to open up, ask questions, and fully engage in their care. This trust leads to greater patient satisfaction and better adherence to treatment plan. Patients who feel heard and more likely to follow medical advice and return to follow-up care. It is allow us to address not just physical health, but emotional and physically as needed as well. Many patients face anxiety, fear, or even depression, and effective communication helps us support them holistically. By doing so, we enhance the overall quality of care. Patients feel more connected, more empowered, and more confident in their journey towards health. All of these factors combine to promote better health outcome. That's the ultimate goal to help patients heal not just physically but mentally and emotionally too. Example like supporting a patient with diabetes. Imagine a patient who has just been diagnosed with type 2 diabetes. It is a life-changing moment, and for many it's come with a flood emotion, fear, uncertainty, stress, and the overwhelming need to their life changer. This is where a nurse's role become a crucial. We step in to provide clear, compassionate education, helping the patient understand what diabetic is, how it affects their body, and what steps they can take and manage to effectively. But just important is the emotional support we offer. We listen to their concern, validate their feeling, and let them know they are not alone in this journey. We also help the patient set realistic, achievable goals, whether it's adjusting their diet, starting a walking routine, or checking their blood sugar regularly. It is about small, steady step towards self-management. And through consistent counseling, we aim to build their confidence and resilience, encouraging them to believe in the ability to take control of their health. In this scenario, the nurses become more than just a care provider. They become a trust guide and source of strength during the vulnerable time. Let's take closer to look at the core technique and bring therapeutic communication to life in our daily practice. We start with active listening. This means giving the patient our full attention, not just hearing the words, but truly focusing on what they are saying and how they are feeling. It shows respect and makes the patient feel valued. When we practice empathy, this involves acknowledging the patient emotion and validating the experience. Even a simple phrase like "I understand this feels overwhelming" can go a long way in making the patient feel support. We use open-ended questions to encourage more meaningful conversation. For example, instead of asking yes or no question, we might say what worries you the most right now. This is invites the patient to share deeper thought and feeling. Non-verbal communication plays a huge role. Simple gesture like maintaining eye contact, nodding, or leaning slightly forward and signal to the patient that we are truly engaged and that we care. We use clarification technique, restarting or summarizing what the patient said to ensure we understand correctly. This not only avoid misunderstanding, but it also reassures the patient that they are being heard clearly. This technique together help create a safe, open space where patients feel comfortable, understood, and empowered. Now, let's look at how we can apply therapeutic communication and counseling in a practical, patient-centered way, especially when supporting some diabetes. One of our most important roles is educate the patient. We help them understand the basics of diabetic management, from monitoring blood sugar to the role of diet, exercise, and medication. This knowledge lays foundation of effective self-care. We work with the patient to set realistic goals instead of overwhelming the big changes. We encourage small achieved steps like reducing sugary drinks, or editing short walks to their daily routine. These little wins help build momentum. We provide emotional support. A new diagnosis can bring fear, stress, and even denial. Just being there to listen and reassure the patient can reduce anxiety and build trust. We focus on encourage self-efficiency and independence. We want the patient to feel confident in managing their condition, to know that they are capable to support in making health choice. We monitor progress and just plan as needed. Diabetic care is ongoing and part of our role in check in regular celebrate process and help patients adapt when challenging come up. This approach not only improves their outcome but also empower patients to take charge of their well-being. When we use therapeutic communication counseling effectively, the results go far behind clinical care. Patients feel heard, support, and value. That emotional connection builds trust, which is the cornerstone of healing. When patients know we truly care, they're more likely to open up and engage their own care. We see improved adherence to treatment plan when patients understand their care, feel involved in the decision-making process, and their trust their nurse. They are far more likely to follow through. This approach leads to better emotional and psychological well-being. Managing illness isn't physical; it is mental and emotional too. Compassionate communication helps ease that burden. All of this contribute to a stronger patient-nurse relationship. It transforms care from routine time tasks into a meaningful partnership. The impact of connection is lasting, its result being long-term health outcome, both physical and emotional. This is why communication and counseling aren't the add-on to nursing, they're essential tool for truly holistic care. To truly connect with our patient and provide effective care, we must recognize and respect the role culture plays in communication. It is important to understand the patient culture background and belief. Culture shape how people view health, illness, treatment, and even how they express emotion. Talking Talking time to learn about a patient culture content can help us avoid misunderstanding and build stronger relationship. We must respect cultural preference in how we communicate. This includes being mindful of things like high contact, personal space, touch, and even tone of voice, as they can vary greatly across culture. We should always avoid stereotypes and assumptions. Every individual is unique, even within a culture group. Insist assuming we are respectful question and stay open to learning. We aim to tailor care to align with the patient culture value. Whether that means adjusting meal plan for reflect dietary traditional or involving family members in care decision. Culturally appropriate care helps patients feel more comfortable and support. When we approach communication with culture sensitivity, we build trust and reduce the risk of misunderstanding, which lead to more effective care and better outcome. At the heart of therapeutic communication is one key principle putting the patient at the center of everything we do. We focus on patient unique needs and prevent. Every individual is different with their own value, lifestyle, and health goal, recognizing they help us provide care that is not just clinically effective but personally and meaningful. We involve patient in decision making, insist telling them what to do. We collaborate, discussing options, and answering questions, making care plan together. Answering questions and making care plan together. This empowers the patient and strengthening their commitment to the process. We prioritize the patient goals and concern, what matter most to them, whether it's managing symptoms, maintaining independence, or just being able to live life fully. We listen and we honor those priorities. Fourth in approach help us foster collaborative care environment. The patient become an active partner, not just reception of care. That partnership lead to be better communication and stronger relationship. Finally, all of this contribute to create a heart treatment plan and higher patient satisfaction. When patients feel respect involved in art, they are more likely to stay engaged and experience better outcomes. As a nurse, our commitment to patient care goes beyond basic treatment. It includes continuously improving our communication and support skills. One of the most effective ways to grow in our role is by attending workshops and therapeutic communication. This section helps us understand how to truly connect with patients on an emotional level. We should also learn new techniques and tools that allow us to support patients more effectively, especially those facing emotional and psychological changes. It is equally important to stay updated and best practice in nursing, as healthcare is constantly involving being informed, help us provide safe evidence-based care. To strengthen our practical skill, we can engage in role playing and simulation. This exercise helps us apply what we have learned in a safe and controlled environment. And most importantly, we must continue strive improve because of ultimate goal is to offer the best possible care and support to every patient we serve. Conclusion: therapeutic communication counseling are essential component in nursing. They not only help us understand our patient better but also play a key role in improving health outcomes. This is especially important in chronic illness care where emotional support and clear communication make a big difference in how patients manage their condition. To be truly effective, we must focus on key strategies such as cultural competence, patient-centered care, and ongoing training. This ensures we respect each patient background, focus on the individual need, and continue growing and professional. By developing this skill, we are able to strengthen our nurse-patient relationship, which build trust, lead to better collaboration in care. Ultimately, this approach helps us enhance the quality of care we are providing and boost patient satisfaction, which is at the heart of what we do as nurses. Thank you.